With meaningful use, we basically mandated that doctors use technology that they had previously chosen not to use. And as you might imagine, that isn't necessarily going to win over the hearts and minds and productivity of those providers. You can't improve healthcare unless you impact what the doctors do, because the doctors control all the healthcare that's delivered. You can't get healthcare without a doctor's order. In many cases, doctors actually do it. And so if they're on paper, there's no way IT can influence the doctor. To really improve healthcare, we need the computers to help doctors do something differently than they would have done had they been writing on paper.
Physicians today primarily go to the terminal to enter data into an EHR as more of a self-defense mechanism than really because they want to.
What we've done so far is we're essentially paving the cow paths. All this paper is occurring, let's get rid of the paper. And today in many hospitals, the paper is pretty much gone. Most of the processes are now electronic. And that's awesome. We can now do stuff. But it's table stakes. And so the next step is to say, okay, now we have electronic processes. Why are those processes the same processes we had when it was paper? Why haven't we rethought the process? Why haven't we thought the workflow? Why haven't we thought the user experience as if we had computers? My
boss likes to say he'd like to delight the physician as opposed to irritate them, which has been the history. That is a very, very important goal.
The issue with physicians and the needs of physicians are so unique that we devote all of our energy to making the physician experience awesome. That's challenging because we have to talk to all these other systems that are in there automating the hospital, but it allows us to come at things solely from a physician's perspective. And if you think about the fact that it's got to be the doctor that changes healthcare, that's a point of leverage, if you will, in terms of impacting care delivery.
With the technologies that PatientKeeper has brought forward, HCA's resources and vision, that we can come up with a solution that satisfies HCA's needs, but also provides a much stronger clinical solution for broader consumption.
The really cool thing is that now we're part of HCA. We can use machine learning algorithms, we can use big data algorithms to begin learning about healthcare so that we can then figure out how to present that to physicians and help them improve. So we have 165 hospitals that are a living laboratory for us, and a mandate from the HCA board to share our learnings with as many other hospitals as we possibly can.